In this video, we will review the PPO plan, which is one of two healthcare plans available to University of Rochester employees that are benefit eligible. To begin with, we are going to review the PPO plan design, and then this video will get into more details as we go. As previously mentioned, this is one of two choices you have for your healthcare plan, and we do offer a similar short video detailing the HSA eligible plan. The next choice you have to make is to choose your TPA or third-party administrator. We offer employees the choice between Excelis or Aetna. And the last choice is who to cover on your plan. We offer employee only, employee plus spouse, employee plus domestic partner, employee plus child or children, and we offer family coverage. As you are making your plan decision, it's important to know that the two plans offered are designed the same, meaning the categories of services covered are the same for both. It also means preventative services on both plans are covered at 100%. Where the two plans differ is in their plan features, which relates to how services received are billed and paid for. The health plan comparison chart, which can be found on the Total Rewards website, is a great resource for comparing the two plans. So as you decision make, you might be interested in what some of the features of the PPO plan are. First is copays. When you enroll in the PPO plan, it means that you will pay a copay versus full cost of a visit for some categories of services covered. So an example of this would be if you were to go to a sick visit or to see a specialist. These are covered by a copay where they are not offered as a copay with the HSA eligible plan. Since the plan includes copays, this means that the premium or rate you pay for your health care out of every paycheck with this plan compared to the HSA eligible plan is higher. And the health plan comparison chart will help you understand that better. The other feature the PPO plan offers to employees is the ability to contribute to an FSA. But you should know that you can also contribute to an FSA on the HSA eligible plan only if you are not contributing to an HSA, and you may also contribute to an FSA if you waive the U of R health plan altogether. The Total Rewards website has short detailed videos that go over HSAs and FSAs that you also might find helpful as you decision make. So before we review more of the PPO plan details, we want to first explain the network options available to you with either U of R plan. Most of you may be familiar with in-network and out-of-network, but as you see on our video, we offer 3 tiers. We offer accountable health partners at tier 1, in-network is tier 2, and out-of-network is tier 3. Accountable health partners, known as AHP, is made up of all U of R doctors and a select number of community physicians. All AHP providers are in-network with Excelis and Aetna, and the website can be used to locate a provider if you are in need. An important feature of the AHP network is that when you visit an AHP provider, you'll receive a higher level of coverage on your out-of-pocket medical costs. So, for example, your coinsurance would be 90% after deductible versus 75%. Plus, with AHP or your tier 1, you'll see that your deductible is lower than your tier 2 or tier 3. Again, the health plan comparison chart shows this very clearly. And so when you use your U of R healthcare plan, you have the option to choose between an accountable health partner or a provider that is tier 2, meaning Aetna Excelis National Network provider, or an out-of-network provider. But you may use any combination of providers. So any providers in any of the tiers, and you do not need to choose a network when you enroll. Rather, you will make that choice throughout the year when you seek services. Your medical costs throughout the year cross-apply between tier 1 and tier 2. And if you are seeking a tier 3 provider, you should speak to your TPA prior to services to see how these costs will be applied to your deductible and your out-of-pocket max. Preventative services. As we already mentioned, this is just another reminder that if a service is preventative, it is covered at 100%, which means no cost to you. We always encourage employees to contact Aetna or Excelis to confirm that your scheduled well visit or service that you're receiving will be considered preventative. Okay, first thing for the PPO plan, and we already mentioned this a little bit, but it's copays. So on the PPO plan, certain categories of coverage will be subject to a copay or a fixed dollar amount you must pay to a provider at the time services are received. Here are some examples. If your primary care physician or PCP is in Tier 1, you will pay a $20 copay for your office visit. If you seek care from a specialist in Tier 2, you will have a $35 copay. If your primary care is in Tier 2, your office copay will be $35. And if your specialist is in Tier 2, your copay will be $65. Next, for understanding your plan design is your coinsurance. Coinsurance is once your deductible is met, all inpatient, outpatient, and ER services are covered at the applicable coinsurance rate. And this is the percentage of the fee that your healthcare plan pays for certain covered expenses once you've met your annual deductible. This chart shows how our coinsurance is designed for your PPO plan throughout all 3 of our tiers. So if you seek services from Tier 1 providers, the plan pays 90%. If you seek from Tier 2, which is your Aetna and Excelis national network, the plan will pay 75%. And if you seek services from providers who are out of network entirely, the plan will pay up to 60% of reasonable and customary costs. Your next plan feature with the PPO plan is an embedded deductible. And this is for inpatient, outpatient, and ER visits. So your deductible is the amount of out-of-pocket expenses you must pay for health services before the plan begins to pay benefits for many covered services. Because this is an embedded deductible, a family member can meet the single deductible and move to the coinsurance phase, even if the rest of the family has not met the family deductible. So this applies to plans that have dependents on them, not a single plan. And here's an example. Dave, Stella, and Grace are in the PPO plan with family coverage and seek services from Tier 1 providers. Dave has an outpatient service and meets his $500 single deductible. He moves to coinsurance and is covered at 90% for the rest of the year. Grace goes to the ER and meets her $500 single deductible, so she will also move to coinsurance. Stella has lab work and only pays $150 towards her deductible, so she has not met her single deductible. The $500 that Dave and Grace each paid toward their single deductible counts towards the family deductible, which at Tier 1 is $1,250. Since the family has contributed a combined $1,150 towards the family deductible, Stella would only need to pay an additional $100 towards the family deductible before she now moves to the coinsurance phase. Prescription coverage is another feature of your PPO plan, and it does not require you to meet your deductible before the plan kicks in. So a 30-day supply of generic drug will require you a $15 copay. Preferred brand drugs and non-preferred brand drugs are both covered per the applicable coinsurance, so it's 20% and 35% as noted, and include a minimum and maximum range for a 30-day supply. And with either plan, you can take advantage of the discounts available to you. So you may use home delivery services to receive a 90-day prescription for 2.5 times the cost of a 30-day prescription, or you can fill your prescriptions at the URMC employee pharmacy for an additional discount. The employee pharmacy also offers courier services for employees at certain off-site locations, and employees can visit their website for additional information. Your next feature is the out-of-pocket maximum, and this is the maximum you will pay for covered medical and pharmacy expenses in 1 year. So if all of your expenses combine to meet the out-of-pocket maximum, you will be covered at 100% for the rest of the calendar year. It is important to note that the PPO plan includes an embedded out-of-pocket maximum. So like the embedded deductible, if any one member meets the individual out-of-pocket maximum before the family meets the family out-of-pocket maximum, that individual will be covered at 100% for the rest of the year. This visual shows how your out-of-pocket maximum is determined, and once it is hit for each tier, services are covered at 100%. As mentioned as a plan feature, employees enrolled in the PPO plan have the option of electing to contribute to a healthcare FSA. A healthcare FSA is a pre-tax account that allows you to set aside money to reimburse yourself for qualified medical, dental, or vision expenses. If you have an FSA, you will pay out of pocket for qualified medical and dental expenses and will be reimbursed from your FSA. One of the advantages of an FSA is that you can pay for your out-of-pocket costs with pre-tax dollars, and this money is available to you. Your full election is available to you as soon as you've hit your effective date of your plan coverage. We encourage anyone interested in an FSA to watch the short video we have on our Total Rewards page that details all aspects of an FSA. And last, this slide is just a list of useful tools and additional information. You can use the ALEX tool, which is our interactive decision-making tool, to get an idea of how the plans work and a cost estimate for each plan. You can view the health plan comparison chart, which details the similarities and differences between the two plan options. You can watch or attend our benefits webinar live. The video that you can watch on demand, I believe, is called our benefits overview video. And all of these items that we've mentioned can be found on the Total Rewards website, which is a great resource. And then if you still have questions, we suggest you contact Ask YOUR HR at the number on the screen.